All right, so we're going to take a look at some of the skeletal muscles today, mostly kind of head, neck, and back. I know that's quite a few, but we'll try to get through as many as we can here. I'm going to try and circle a few of the ones I think you specifically need to know, and then there's a couple of pages in the textbook, 217 and 219. I'm going to try to make a copy of those for you guys today and get those up, but it's got kind of origin, insertion, and then primary action for those muscles. You're not going to be responsible for origin or insertion, but you will be responsible for kind of the action of a few of them. All right. And I'll try to make sure I highlight specifically some of those for you today. So we're going to start here with the kind of head and neck, some basic muscles that we kind of need to know. So you've got a few of them that kind of go directly over top of some of the skeleton bones of the skull. So you got like the frontalis and the occipitalis. Those are basic ones that I would kind of make sure you know. They might show up on the diagrams, but they're fairly easy ones. So the frontalis is right over the frontal bone. The occipitalis is right here in the back, directly over the back of the occiput. We got a couple other ones. There are two that kind of start with the same name. So there's the orbicularis oculi and the orbicularis oris. Okay. So orbicularis oculi, the name there basically states eye. So that's the muscles around the eye. These are the ones that allow you to blink and wink. Okay. And the orbicularis oris is the one around the mouth. This is the one that allows you to open and close your mouth. It's involved a little bit in smiling. Okay. Got another one here. It's called the buccinator or buccinator, however you kind of want to pronounce that one. That one specifically, I would make sure I kind of know. It's one that allows us to whistle. All right. And it also is one that allows us to kind of push food up against our teeth when we chew to kind of be able to kind of do that for us. All right. So it's got a couple different basic kind of motions for us. A lot of these other ones like zygomaticus, masseter, they're involved in chewing. We talked a little bit about this one the other day, the sternocleidomastoid. All right, that's the one that goes from the sternum, clavicle, and then goes all the way up to the mastoid process. That one does neck flexion if you contract both of them. And then if you only contract one, you're going to get rotation with a little bit of flexion. Okay, so that's that one over there on the side. Some of these other ones I would obviously kind of make note of, but they don't really show up so much on the kind of assessment. I think trapezius does. All right, but we'll see it again here on the back. All right, but I'll label it now. But the trap, essentially, there's an upper, middle, and lower portion of that, and we'll see it here on the back portion. And then you've got like your temporalis. There's an aponeurosis here, but again, those are ones that won't show up as much on the assessment. Temporalis muscle is one of the ones that is right above here. Most of what it does for us is kind of it's an aider in chewing, but some people can actually use their temporalis and wiggle their ears. Anybody do that? Ken? I can. Yeah. Oh yeah. Yeah. It's something that as we've evolved as humans, like we don't use it as much anymore. So it's not something that kind of continues with us, and we just. But that's what allows like cats and dogs and everybody to kind of locate their ears, kind of move their ear around and kind of locate a sound. And at some point, evolutionary, we as humans were still able to really kind of do that. Now our ear is pretty well fixed to the side of our head, so we can't do that. But there are still people that can do that. There is also another muscle that's attached to your eardrum that if you contract it, you can make it sound like you can hear like a rumbling or like a thunder sound. All right. So can you guys do that or no? Like if you just do it, it'll make like a rumbling sound in your ears. Yeah. Not everybody can do it. Karen's like, you crazy. I don't know how to describe how to contract it for you, but like if you can contract it, yeah, it's like think about trying to contract. There's a muscle kind of back in here, but it attaches to your eardrum, and if you do it, it almost sounds like a thunderstorm going off in your ear. Right? Most people can do it, but not everybody. It's one of those things. Okay, so those are some of the muscles of the head and face. All right, workbook pages. This is in there too, so you guys can kind of help kind of color them for yourselves as well. But that's in there. Muscles of the back then. So the main ones here that we want to take a look at then are the trapezius. All right, so this is that kind of trapezoid shaped muscle. There's a lower, middle, and upper. All right, so it does a couple things for us. It does shoulder shrug. It actually does head hyperextension, so it allows us to extend our head backwards. Okay. Another one you can see here that I would make sure I kind of know is the deltoid. So that's the muscle over the top of the shoulder there. That one does abduction, abduction of the shoulder. All right, so it raises it out to the side. Another one that I would make sure I kind of note is the latissimus dorsi. That's this really broad muscle across the back. Bodybuilders are people that have this pretty well defined. This is what gives people that V shape on the back of them. A lot of times, this is what's also referred to as the swimmer's muscle, right? Because swimmers, a lot of times, will have this pretty well defined. And then since we're back here, you can see this one. We'll see it again, but triceps brachii is another one I would kind of make sure that you note its location, but that's an elbow extender, okay? I covered most of those there. Okay. And then there's the workbook pages that kind of have them labeled out again for you with some colors. Those will be up in the notes for you guys as well. Trunk muscles are kind of muscles here at the front. All right, so you got, again, deltoid. I make sure I would kind of make note of pectoralis major. All right, so it goes from sternum all the way out to the humerus. That's an adductor, horizontal adductor of the humerus. All right, you got a couple of biceps muscles. So the largest one there is the biceps brachii. All right, and then there's another one called the brachialis, which is more medial. All right, so it's right in through here. And then there's the brachioradialis that goes down the outside. So it runs down the outside. That's the one that does the thumbs up contraction, or kind of the hammer curl contraction that you think of. Abdominal muscles. Most of these aren't ones that we're going to kind of see, but the big one that we normally kind of make you guys know is this rectus abdominis. All right, that's the one that usually gives people the kind of six-pack abs when they can see those, essentially when the fat's gone over the top of them. All right, but you've got several other ones. You've got transverse, internal, external. All right, but the main one I think that we're going to make you guys remember is the rectus. Okay. Those are there so you can color them again. These right here, the blue ones, that's the sternocleidomastoid. All right, just to make sure you guys kind of note that. But a lot of the other ones there are kind of put in. And then muscles of the upper limb. So this is where the deltoid would show up a little bit more. And then you've got both the bicep. I think my battery's dying on my pen. You've got bicep and tricep. And then what we can see here, because we can see the back of the hand, you notice that all of these are extensors. All right, the only one that isn't is this one here, which is the flexor carpi. That's a flexor because it's going around and attaching to the medial side of the elbow. But this would be lateral side of the elbow right here, where all of these guys have attached. Okay. And I don't think we've got you kind of remembering a whole bunch of those. But again, the colors are there for you. Muscles of the hip. A couple of the ones that I would make sure I kind of note here. Obviously, your quadriceps group as a whole, all right, those are knee extenders, okay? Basic ones to know are the vastus medialis and the vastus lateralis. So you notice that the medialis runs here on the medial side of the leg. The lateralis runs here on the outside of the leg. And then there's the rectus femoris here in the center, right? But those are your basic ones that you see there in the leg. I think we got you with too many other ones there. All right, lower leg, big ones to kind of remember. We've got the gastroc. We got this real small kind of muscle over here on the outside, tibialis anterior. Tibialis does dorsiflexion. Gastroc does plantar flexion. Okay, so those are the big differences there. Those are antagonist muscles. There's another one called the soleus that runs more kind of on the outsides. All right. Gastroc is a two-joint muscle, so the gastroc actually goes across the knee. So sometimes we'll get athletes that'll come in that have got pain kind of in the back of the knee, and most often it's their gastroc, and they just don't notice that, okay? Whereas the soleus is not a two-joint muscle. The soleus attaches directly to the tibia and then attaches to the calcaneus through the Achilles tendon there. Okay. I don't think you need any more of those. All right, and then this just is a basic anterior view. All right, so some of the ones I would make sure you kind of look at. You got your orbicularis oculi, oris, sternocleido, deltoid, tricep, bicep, brachioradialis is one that I would know. We got rectus, then the vastus and medialis, and then the tibialis anterior. Okay, I think that's the diagram that's on the assessment, guys. Is a kind of full frontal view. We don't kind of break it down into the smaller ones, so just make sure you kind of have note of a couple of those. All right, there's the picture of it. Backside, you've got occipitalis, trapezius, triceps again. Trying to make sure I get them all for you. We got glute max. And then the ones that we really haven't seen on the backside of the leg yet, there's the hamstring group themselves. All right, and then there are 3 muscles that make that up. There's the bicep, the semimembranosus, and semitendinosus. The one that I think we're having you remember for the assessment is this tendinosus. All right, so notice the semimembranosus and tendinosus run kind of medial here, and then the bicep femoris is more lateral. All right, that's kind of part of the hamstring. So if you palpate kind of on the backside of your knee a little bit, you can feel that there's actually 2 tendons there on the inside and only 1 tendon on the outside. The 2 tendons on the inside are the membranosus and tendinosus, and then the one on the outside then is the bicep femoris. Okay, these 2 I would make sure I note: gastroc and soleus. All right, those will probably show up. But I think that's about it. I think deltoid's another one there that you might want to make lat. All right, but you're just going to have to pick them out for the most part. Okay, I think that covers most of them. You guys got any questions on that? I know I went through that really quickly. Again, most of that is just a diagram like it was for the skeletal system. All right, so just make sure you kind of note their location. And then there's just a couple that we're going to give you the function of, and I'll make sure I put those on the review document when we take a look at them. Okay. All right. Stop that and get it posted.